one doctor of a particular specialty who will speak to us about COVID-19, the precautions we need to continue to take, and other information we need to be responsible citizens in this time of crisis. Doctors are silent warriors, toiling away relentlessly in the noble profession of saving lives. Through the waves of this pandemic, doctors and all healthcare workers have emerged as our superheroes. They continue to give to the society with great risk to their own lives so that we can remain safe and healthy. Sakara brings to you Vaidya Saptaha to create awareness and to understand the gravity of this situation. Even though the pandemic began in late 2019, we are still grappling with it, trying to come to terms with the changes that the pandemic has brought about in all of our lives. So we believe it is not too late to educate ourselves, to be responsible for our own health, and to be safe during the course of this pandemic. This evening, we have with us Dr. Raghavendra D. Kulkarni, a medical microbiologist, professor and head of the Department of Microbiology at SDM Medical College and Hospital, Dharwad. He completed his MBBS and MD in microbiology at Shivaji University, Kolhapur, and has 37 years of clinical and academic experience to share with us. He has also received advanced training in molecular biology at St. Giles Laboratory of Human Genetics, the Rockefeller University, New York, and Human Genome Center, New York. He has received many awards, accolades, and has many publications to his name. He has also served as the president of Indian Association of Medical Microbiologists for the year 2015-16. He is also a guide, PhD guide for medical microbiology, and an external referee for PhD in fine arts music for the University of Pune. Welcome, sir.
Yes.
We thank you very much for having agreed to join us and for being a part of this venture of Sakaras. First of all, I want to wish you a very happy Doctor's Day.
We wish you a very happy Doctor's Day too, Samata.
Thank you, sir.
Dr.
Thank you,
Samata.
sir.
Yeah.
Let us
Thanks
dive
so much
right
and
into
thanks
it.
for the opportunity.
Thank you. Let us dive right into it without much further ado. And
So,
we will start with the basics. So,
yeah.
what is this virus? Where has this come from?
Now, the coronavirus is commonly, the popular name is coronavirus. The thing is that this virus, coronavirus is a group of viruses. There are total 7 coronaviruses. Out of this, SARS-CoV-2 is the latest coronavirus. We really do not know from where it has come because there are a lot of speculations, a lot of theories have been put forward about the origin of the virus, but we are not yet sure. Probably it has jumped from animal species to human beings, and it is thought that probably it has come from bats to human beings. But whenever any virus comes through bats, especially the other coronaviruses which come through bat to human beings, there is also one intermediate host. Usually there is a link between bat and human beings, which is another animal. And so far, we are not able to trace any link. So we do not have a clear clue of from where the virus has come.
Okay. There are, in the beginning, it was only COVID-19. Now there are many mutants. There are many variations in the
Yes.
virus itself.
Yes.
So, what are these mutants and why have they come into existence?
Very nice question. Thank you very much. This is viruses broadly are classified into DNA viruses and RNA viruses. DNA is a very stable molecule, but RNA is not a stable molecule, it's a fragile molecule. The entire code of the virus is there in the RNA, which is the nucleic acid of that virus, of SARS-CoV-2. RNA has an inherent capacity to go on changing. I'll give you an example of HIV. HIV is an RNA virus, but it is frequently changing its phase, what we can call as an immunological phase. And that is why, in spite of HIV being around for more than 30, 40 years, we are not able to produce any vaccine against HIV. This is one virus which is again an RNA virus. SARS-CoV-2 is an RNA virus. And since this is an RNA virus, it has the inherent, capacity to keep on changing its genetic code or phase. And so it's a natural process in the life of any RNA virus. This happens.
We've had this pandemic since late 2019, and we've gone through the first wave, the second wave, and now we are heading towards the third wave.
Yes.
So why has the pandemic come in waves? Why has it not come at one stretch and then full blown and then gone? Why is it? Why are there peaks and valleys?
Initially, when the virus came, there can be multiple reasons for this. We cannot just single out that this is the reason for waves. So it's a interplay between the virus, the structure of the virus, and human behavior and human immunity. All the three things are there involved. We know that this is the first time this virus has come to the globe. This virus, humanity never knew about this virus before. That is why our immune system is not able to combat this virus at the beginning. What happens is that our immune system needs to be trained. Our immune system is trained against a host of big list of viruses. That is why we are free of disease. Any virus, most of these viruses which are coming to our body, we are able to combat them easily. Since this is for the first encounter of the virus, our immune system, human beings did not have a trained immune system to combat this. We suffered, and the virus spread like fire. Why it spread like fire? Because it's a respiratory virus. And any respiratory infection can spread very quickly. That is why the virus spread very rapidly. And one important point, that this virus has a tremendous capacity to get to transmit from one person to other, get transmitted from one person to other. It has a tremendous capacity. So this transmissibility is very high in this virus. That is why the virus spread all across the world. All 7 continents have been, infected. And then slowly that group of people started following the norms which have been laid down by WHO, especially social distancing, use of mask, and hand washing. These are the only 3 weapons we have against these viruses. Those people, when they started using this and when they were forced to do this by lockdown and other processes, then the transmission stopped or it minimized. When the transmission minimized, the spread of the virus came down and the wave came down. But the viruses are extremely smart. They are intelligent. See, this is maybe some people may take it as a funny statement, but I'm serious about it. Viruses are intelligent. These microorganisms have 3 billion years of living experience compared to more than human beings. We are here on this globe for more than just a billion years. They are here for 4 billion years. So they are 3 billion years senior to us. And as per the Darwin's theory, they are the best survivors. They are the fittest survivors. They know the mechanisms. Once the virus understands that human being is resisting transmission, the virus changes itself. Once virus changes itself, so far what our immunity has learned about this virus, some completely different form it takes, antigenic different form it takes, and which is not recognizable by the immunity of people. And thus this virus gets an opportunity to break through the immune resistance of the population, and thus it spreads again. So this is another reason. This is how mutants go on spreading. Another important thing, of course, is human behavior. We know how the virus is spreading. We know what are the precautions. And in spite of knowing that, we are completely ignoring or flouting all the rules and regulations. And we are at our will to go anywhere, to attend parties, marriages, so many other things without using masks. And some people even consider this as a foolish thing to use masks. Even the best educated group lot I have seen that they wear the masks very cursorily and without any seriousness behind it. So all these reasons are there why the virus is appearing in waves. Season also is very important. Season also is an extremely important thing. Previously, it was thought that last first wave when it started, then they thought that in the month of May, June, when the heat will be very high, April, May, the virus will be subdued, but the virus was not subdued. It was spreading very rapidly. Then and it was involving huge population. Again, it was told that when the winter season will be there after any season, all the respiratory viruses are on, say, high speed of transmissibility, and there will be devastation. COVID will be devastating. So that's the prediction. That also went wrong. And when again from February this year, again the virus started rising during the heat. When the atmospheric temperatures were quite high, the spread of the virus again began. So this is how the season also is casting some effect on the waves, and this is how the virus is coming in waves.
You spoke about immunity, so I want to ask, each person who has contracted the virus has reacted differently. So what is the role of immunity in all this? Why are they reacting differently?
Will you please be a little loud?
Yeah. You spoke about immunity.
Yeah.
And each person who has contracted this virus has responded differently to it. So what is the role of immunity, and why is there so much difference in the way the patient is presenting and responding to the disease?
So these are the biological differences in the people. I'll give you one example, set of people. Suppose there are 100 people exposed to the virus. This is a hypothetical situation. 100 people are exposed to the virus. All of them are exposed. Okay. Out of that, one group will be there which will have a very potent immunity. Immunity has two parts: cell-mediated immunity and humoral or antibody-mediated immunity. And immunity has other two versions called as natural immunity and acquired immunity. Acquired immunity is trained by the viruses. New pathogen, when it comes, encounters, then we learn about that virus or bacterium and we generate antibodies or cells responsive to that particular antigen. Natural immunity is very important. So out of those 100 people, a chunk of people who are having excellent natural immunity will not suffer from the virus at all. They will not even know that they have been exposed to the virus and they had infection. 1/3 of the people, or one chunk, will be suffering from mild infection and they will recover on their own. And the third chunk of our third segment of our group of people will be clinically ill. Okay, so now we are having three groups of people, and all the three groups are infected, exposed. Though they are exposed, only few are suffering. This difference is created by immunity. So individual differences are there, and those who are infected also, many of them get cured on their own. that they don't need treatment supports. Some get cured after treatment support, and some they land into say hyperreactivity of the immunity. Our immunity, while reacting, reacts so violently that it produces what is called as a cytokine storm, and it is a activity of the immune system, which itself is your own enemy. So your immunity is working against you, and your disease gets, say, very nasty curve or progress, and then patients suffer a lot from it.
There are two tests for COVID, the rapid antigen and the RT-PCR.
Yes.
What are these two tests, and how are they different from each other, and which one is more sensitive to detect the COVID virus?
Okay. Okay. Uh, Rapid antigen test and RT-PCR, as you said, are of course the two different tests. Rapid antigen test is less sensitive, or we can say RT-PCR is the uh, most sensitive test or better test amongst these two. Now, this RT-PCR, shall we discuss RT-PCR first?
Yes, yes.
Sure. So, RT-PCR is reverse transcriptase polymerase chain reaction. That's the short form. What is reverse transcriptase? It's an enzyme which converts the RNA of the virus into DNA. Because any PCR which we are doing in the laboratory, it has to be DNA PCR. We do not have RNA PCR commonly available or in the laboratories. So we have to have a DNA PCR. But virus is RNA virus. So we convert that RNA virus into a DNA virus, into a DNA copy. That copy of the RNA of the virus we convert into a DNA, and we test whether that virus is there or not. That is why it becomes reverse transcriptase PCR. The importance of this PCR is that very minute amount of virus particles can be detected in the sample. Very minute quantity, less than 50 copies of the virus. Say, there was one, say, that was of course a WhatsApp circulation, but there was a lot of truth in that. The entire virus on the globe, which is causing such a devastation in the human beings, the total quantity is not more than 2 grams. That is what they say. Okay, so there is a say some reality in that statement. So this virus, 50 copies is as good as no copies. So RT-PCR can pick up that small number, such a sensitive test, and it is highly specific. If the person does not have that particular RNA copy in that sample, the test will be negative. So there is no chance of this being false negative. Oh, sorry, false positive. False positive will not be there. If it is positive, the person is having that virus. But what is a rapid antigen test? Rapid antigen test is not dealing with the nucleic acid of the virus. There are some proteins on the surface of the virus which are called as viral proteins. And these proteins on the surface of the virus, they are detected using specific monoclonal antibodies against them. The test is very simple. It's just a very small card of your 2-finger size. This size is the strip. In that strip, at one spot you load the patient sample and buffer, and the sample will migrate along a sort of filter paper. And if the test is positive, a red line will appear at the designated, say, spot. Red line will appear, and that will indicate that it's a, but what it detects is the viral proteins which are there in the patient sample. So this is less sensitive, very less sensitive. So we should not 100% rely on this test. If it is positive, it is pakka positive. But if it is negative, you have to confirm by RT-PCR test. Sure.
We stepped into 2021 hoping to put the pandemic behind us because the vaccines came into the picture.
Yes.
And now there are many types of vaccines. There's Covaxin, Covishield, Sputnik. So
yes,
how protective are these vaccines, and how much can we become laid back because we are vaccinated?
there is very clear evidence that vaccines are protective. When the vaccines were about to be launched in the market, research was at its peak during the last March. That time, more than 80 vaccines were in the pipeline. Now in India, five vaccines are almost available. Two are our own produced, India produced vaccines, and three from abroad. So these vaccines are available. World over, when WHO wanted to accept a vaccine and say that yes, this can be used in public, what was the safety? What was the protective level they expected? WHO expected the protective level to be 50%. If the vaccine is 50% effective, they say that it can be used in the public, in the field for public protection. Now the current vaccines, they have different sensitivities. Messenger RNA vaccines which are there, they are highly efficient. The protection rate is almost 90%. But Covishield and Covaxin, they also are very potent, and their potency is between 70 to 80%. So they are very good vaccines, and everybody has to be vaccinated. Those who let me tell one important thing to say our audience.
Yes.
That any vaccine in the world is not for protection against infection. This is a very weird statement you will feel. Vaccine is not for protection of infection. Vaccine is for reducing morbidity and mortality, disease and mortality. That is the role of vaccine. So don't expect that you will be prevented, your infection will be totally prevented. You may get infected. Most of the times when you are vaccinated, even if you get infected, the disease will not be there anymore, and it will be aborted. The infection will be aborted without any clinical disease. Occasionally you will get clinical disease, where that disease also will be very less severe, and very few people, less than 1% of these vaccinated people, may have a serious disease. So vaccine is effective, and any vaccine, they don't give a special choice to a vaccine. Which is available for the first time, you use it. Don't wait for the next vaccine to come.
They are now telling that the first dose of one vaccine and second dose or the booster dose of another vaccine. How efficient is that?
Again, a very good question, and this is a very people have a lot of interest in this particular discussion. Why this is increasing? See, the doses, 2 doses which we are recommending. I just go back to pediatric vaccination. Okay, everybody knows diphtheria vaccine, DPT, triple vaccine, they say.
Yes.
Or polio vaccine. Polio vaccine we are giving every year to children below 5. DPT vaccine, we give 3 doses to the child. Then one at school going again we give. Then every 10 years it has to be given. So this is called as booster effect. When you give the vaccine for the first time, the immunity of the body reads the particular antigen. Okay, antigen is anything foreign, immunologically foreign to the body, that is an antigen. So body reads that antigen, and immunity has one very specific goal or motto, that eliminate anything that is not self. Eliminate anything from the body that is not self. If the vaccine is coming into the body, immunity recognizes that it is not self, so it stimulates its own army of cells and antibodies to combat that particular antigen or virus. Here let us consider its virus. Okay, to combat that. The first encounter produces the primary effect, stimulation of immunity. The second or booster dose, it gives a very strong stimulus once again to the immunity, and you get a secondary immune response. The secondary immune response is very strong. Okay, and it is lasting for a long time. That is why 2 doses are very essential. For the first dose and second. Now about the difference in the vaccination, the doses. Say this particular discussion has come up for Covishield rather than other vaccines. Now people have some misconception that because of the availability of, or paucity of vaccine, less availability of vaccine, government is trying to delay the vaccination of second dose. That is totally wrong. It is not based on Indian government's say hypothesis. This is based on concrete evidence which has been generated from other countries, including Europe, America, and Africa. Vaccination trials have been done, and the dose difference or say spacing between first dose and second dose, that spacing has been tried between 4 weeks to 32 weeks. And now they have come up with one say recommendation that between 4 to 12 weeks you can give, and once you increase the space up to 12 weeks, the potency of the second vaccine or protective efficiency of the second dose rises to 91%. So that is the reason, and this is not based on what government thinks, or this is not based on the logistics, availability of vaccine. This is based on hardcore scientific data, and we have to honor that. Thank you.
Lastly, sir, I want to ask you, what message do you want to give to the public on this occasion regarding COVID and regarding all the precautions that we have to take?
Most important, what things have been advocated by WHO, by government and other agencies. 3 things are prominent. Use of mask, extremely important, and use of mask should be very proper. It should cover your face from nose to, this is the N95 mask I am wearing. Okay, it should cover the face from nose to below chin. Okay, this is the way you have to put on mask. People have masks like this. Okay, people have masks like this, and many other ways they put on masks. Okay, so that is absolutely incorrect. When you are alone in the room, when you are in your own house, there is no need to use mask. If all are healthy, nobody has symptoms, that time you need not use. But whenever you are in the public, whenever you are across somebody who is unknown to you, and anybody who is there who may be infected, you never know. So that time you have to have a mask on. Second, hand washing, frequent hand washing. There is no need to use sanitizers. Soap, sanitizers will take 1 minute for action. Soap will take 30 seconds. So 30 seconds of hand washing with soap is the best. It is cheapest. It is less expensive.
Yes.
Okay, and third, of course, is social distancing. All these 3 norms we have to follow. In whether you are vaccinated or not is not a question. These norms you have to follow. Then everybody has to get vaccine. This is the one message. And the last thing I would like to say, not as a message, but just as an information,
yes,
that last 30 or 40 years, there are several viruses have come to this globe. HIV has come. Okay, Ebola has come. Zika virus has come. Then H1N1 swine flu virus has come. SARS-CoV-2 is now, but SARS-CoV had come in 2002. MERS, MERS virus came in 2012. So several viruses are frequently coming to, and they are new viruses. We don't know anything about it. So all these viruses, though they are there around us, don't feel that it is the end of it. Another 5 years, 6 years down the line, 10 years down the line, you are going to have a new virus. Okay, so this is going to be there. So you have to be prepared. Unfortunately, this time it was a very bad virus because the infectious potential transmissibility was very high. The mortality, what it caused, 1% or 1.5%, whatever, around that, less than 2%. But see, consider 2% mortality in a country like India is devastating.
Yes, yes.
When in the peak time, just 25 lakh, we have a population of 1.38 crore, 138 crores.
Mm.
In 138 crores, you count the people who are actively infected, just 25 lakh people actively infected. It doesn't even come to say 0.5%. So when 0.5% of your population, not even 0.5%, it is much less than that,
Yes.
is infected, your entire health system is completely haywired. You cannot control anything, and you don't know how to say save people and cater the needs. Impossible. Your health system is completely debacled by just this small number compared to your entire population.
Mm.
So 1% or 2% mortality, don't consider that it is a low mortality, it is a very high mortality. And like this, many viruses are likely to be there in the future. So this is a lesson for us to abide by the guidelines given by WHO and government. If we flout that, we are going to have it. There is no point in blaming government for spread of virus. We are spreading it.
Yes. Yes.
That is it.
Thank you, sir, for spending your valuable time with us and sharing with us the information and answering our unanswered questions. Thank you very much. We're very grateful to you.
Yeah, I too am really grateful to you for giving this opportunity to interact with maybe so many people there listening to this. So really thankful to you, and it's a very sensitive issue, very say close to my heart, and this was an opportunity to speak to all of you through you and your say foundation. So
Yes.
thank you very much.
Thank you, sir. Thank you. We spoke to medical microbiologist, professor and head of the Department of Microbiology, Dr. R.D. Kulkarni from SDM College of Medical Sciences and Hospital, Harvard. He stressed throughout his talk to follow the guidelines laid down by WHO and the government. Masks are mandatory. Social distancing at all events is mandatory. Going out, if not strictly necessary, then please stay at home. And also, frequently washing your hands using soap and water. He also gave a lot of information about the virus itself, why this pandemic happens in waves, why the virus is changing itself to attack us, about the tests that a person has to undergo when he or she has contracted COVID, and also about how important it is to get vaccinated, how important it is to follow all precautions even if you're vaccinated. I hope you found this session as informative as I found it. And tomorrow evening at 6 p.m., we bring to you a pediatrician from KMC Manipal, Dr. Kaushik Urala. He will be speaking to us about children and COVID, about what precautions to take when schools reopen, and how parents have to manage children with COVID, and many such questions. Thank you and have a good evening.